Hi, I'm Tracy Wharton. I'm sorry that I couldn't be there tonight. We are really grateful to have been recipients of one of the grants last year, and that $2,000 has gone a really long way. So I want to share with you just a little bit about the larger project that we've been able to contribute to and the work that we're doing in the next couple of minutes. As you can see in the slides, um, we have a lot of members of this research team. We have members here, but we've also partnered with folks in Colombia to look at this from different perspectives. The objective of the study was to explore the experiences before, during, and after the journey of immigration from Venezuela to the United States. And the objective was really to start looking at models and policy recommendations for culturally relevant services for Venezuelan immigrants to the United States. I'm sure that many of you are aware of what's been going on in Venezuela. This particular group right now is one of the largest migrations in human history. So what did we do? We held focus groups here in Orlando, and we're beginning to hold those in Cúcuta, which is a town right on the border of Venezuela and Colombia. I'll come back to that point later. But with the grant from CBHRT, what we did here was we were able to buy food and gift cards for participants, and that was a huge way to give participants or potential participants the opportunity to ask questions, to get to know each other, to get comfortable in the space before we really jumped into asking the questions that we needed answers to. We had 5 focus groups and 6 individual interviews. So it was really great to be able to have some food, especially when we're talking about families who were coming from work or they'd worked all day, and we were looking at having these around dinner time. So we were able to give people food. That way nobody was, wanting to leave because they were starving or anything. And it really broke the ice, really just more than I could have imagined. We had 2 research assistants from UCF. One of them is our MSW student, Hilaris Garcia. She was previously one of our HEALS scholars as a BSW. And the other research assistant is Matt Abrams, who's now a 3rd-year medical student. Once we did the focus groups, we transcribed those in Bogota, and we uploaded de-identified transcripts of these to Deduce, which is an online secured platform where we could all work together on the data analysis regardless of where we were. So we had 3 funded research assistants in Colombia, Matt and Hilaris here, and also Andres and myself and another faculty member, Angelica Vargas, and Heather Peralta from the School of Nursing, all working on the data analysis together, and we were able to share that in Deduce. We've done in vivo coding. We've come up with codes. Our research assistants are currently going through and finishing up some focused coding for us. As far as further funding, we did apply for, I mentioned those 3 research assistants in Bogota. We applied for and got a grant from Colciencias, which is Colombia's National Research Office, and it funds 3 students to work on this research. 2 are graduate students and 1 is an undergraduate. That undergraduate is actually going to be coming to UCF for 3 months in the spring. We have 1 manuscript that has already had a revise and resubmit. And we have a 2nd manuscript with our findings that is currently in the writing process, and we continue to work on taking a look at different aspects of the data. We've also been privileged to do a number of presentations about our preliminary findings, including at SWIR, at AUPHA. I did an invited lecture at Javeriana University in Bogota, where I talked about immigration issues to the United States, and presented at a conference in Bogota as well about healthcare systems. We spoke to 48 people, mostly female, very well educated. 85% of our group had higher education. Mean age was about 45 years old, and that was kind of most of the people were in their 30s and 40s. We did have a few older folks and a few folks in their 20s. More than half the group was married. People had come to the United States for a number of reasons, but most of them were economic. They talked about fear for their children, issues of safety, lack of access to medical care, food scarcity, a lot of the things that we've been hearing about migration from Venezuela. Participants tended to be from privileged families, and life in the United States was really significantly different for them. Their socioeconomic status changed very rapidly when they spent all of their money here, and they really had a very different life than where they had come from. The majority of our participants were waiting on some notice about their asylum status. Most of them had applied, and they were kind of living in limbo, which made it very, very difficult to work, very difficult to rent an apartment, to buy a car, all kinds of things that we think about in the course of our life. So what did we learn? Well, unsurprisingly, we found out that many of our participants talked about stress, isolation, discrimination, frustration, sadness over the people that they had left and been separated from. On the other hand, they also spoke a great deal about finding support, particularly from other Venezuelans, people that they had had connections with or built relationships with. Disruption of family systems and social networks, both positive and negative, was thematic. And one of the things that we saw over and over is that people who were able to rebuild a social network and build new connections, talked about their new family and their new friends, those people were more resilient and less vulnerable to obstacles and challenges. One of the things that we did hear quite a lot was that people had training and education for various things like doctor or lawyer or engineer in Venezuela, and they were unable to do those things here, in part because they couldn't get documentation or records, and in part because licenses don't transfer. So there was a lot of stress, a lot of frustration, a lot of isolation, and feeling hopeless. And people who were able to connect to other Venezuelans or people who had had a similar experience really felt like they had more hope and they had a lot more support. We did ask people about their perception of mental health services in the United States, and people had a pretty high opinion of the services. However, only 12% of the people had ever accessed any kind of mental health service in the United States. So we thought that was kind of an interesting disparity that's worth noting. We did notice a number of both risk and protective factors. I mentioned that social network thing. Those relationships, the ability to create new support structures, that really seems to be a key theme. The risk factors are many of the things that you would anticipate: language barriers, discrimination, culture shock. Many of the families that came spoke more than one language. So many of our participants spoke German, someone spoke Norse, Italian, Portuguese, but not English. And so not speaking English was a barrier to them. And they said that people often perceived that they were low education or that they were something other than who they are because they did not speak English, even if they spoke multiple languages. So all of these things really contributed to a lot of stress and strain. People in the groups had a number of recommendations that they wanted us to share with everyone. I mentioned the language barrier and the perception of who they are. One of the things that came up fairly frequently is that in the United States, we don't do a very good job of distinguishing the diversity among various Spanish-speaking nations. In other words, if you speak Spanish, then you go to the Spanish-speaking provider, and that provider may or may not be from a similar culture or from the same culture as the one that you come from. It just so happens that they speak the same language. And so they really wanted us to share with a lot of the mental health providers and the medical providers around town that the Spanish-speaking world involves a lot of different kinds of populations, and they wanted us to try to educate people that there are universities in other parts of the world, and that people coming from other places have different histories, have unique cultures, even the language is different in many places. So they really wanted us to share with that, to share with the local providers. Also, one of the things that they noticed, which I thought was rather poignant, was that our healthcare system is set up so that there is an identified patient. And this is true for medical care as well as mental health care. And so you're focused on one person, but they were really focused on the family. And so a lot of these participants were very clear that some of their mental health challenges and even some of their medical challenges involved their family members. And so they wanted people to know that they really have this family and social context focus, and to incorporate that into the way that we provide care. I thought that fit really well with our social work view of the world. And they really wanted us to make sure that we understood and shared with our colleagues the diversity around those kinds of identities. So next steps. We are collecting data in Cúcuta, Colombia already, as I mentioned. As of the moment that I'm taping this, we've done 15 interviews, I believe. We've not been able to do groups there, but we continue to work on building those relationships with local providers and the local population, and building some trust so that we'll be able to do those focus groups. And we're very hopeful that we'll be able to do that there very soon. We're working on a couple more manuscripts, focusing on some of the more complex issues related to resilience and the journey of immigration, along with beginning to compare the experiences of these two populations. We're looking at some policy briefs in both Colombia and the United States to our policymakers to try and share some of the things that we've learned. We're working on a resource guide website for mental health and medical providers in the US. I mentioned trying to get the word out to our colleagues. What better way than making it accessible? So we're going to be looking for some funding to go ahead and finish that up. We do have a prototype. If anyone wants to see it, please come find me and I'm happy to show it to you. We're also examining some previous work that's been done in Colombia on workshops for medical personnel that work with displaced populations. And we're going to be taking a closer look at those workshops to see if they could be adapted to the US context, and whether that might be worth doing. Once we nail down the details of that, we'll be talking about how to fund that and where to go. We are really grateful for the funding that we got from the center. It was the perfect amount to be able to really break the ice and really get some great data from these focus groups. So sometimes just a little bit goes a very long way, and it really did help us open the door to building this partnership, to building these relationships with the university, with the Institute of Public Health. I'm trying to put up on the screen for you a QR code if you're interested in seeing some of our presentations that we've done, or looking at some of the related publications and some of the current data around this population. Please scan the code, check out the website, and we would love to hear some feedback. Thank you so much. I'm sorry that I couldn't be there, and congratulations to all of the new recipients of funding.